Hi everyone, my name is Jenna Clavette and I will be the facilitator for my group's presentation on substance use disorder. I would like to recognize my fellow group members, Jasmine, Emily, and Shane, for their hard work on our project. It's important to first understand the definition of substance use disorder. According to the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, a substance use disorder occurs when the recurrent use of alcohol and/or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. Overall, the diagnosis of a substance use disorder is based on a pathological pattern of behaviors related to use of the substance. As you can see, there are 4 groups of criterion. Criterion 1 through 4 can be considered to fit within overall groupings of impaired control, social impairment, risky use, and pharmacological criteria. Criterion 5 through 7 include social impairment. Criterion 8 through 9 include risky use of the substance. And criterion 10 through 11 include pharmacological criteria. The requirement for diagnosing a substance use disorder is the client has a pattern of substance use leading to clinically significant impairment or distress, as manifested by at least 2 of the following criteria occurring within a 12-month period. Some of the diagnostic criteria for substance use disorders include using in larger amounts or for longer than intended, wanting to cut down or stop using but not being able to, cravings, continuing to use even when it causes problems in relationships, continuing to use even when it puts you in danger, and increasing tolerance and withdrawal symptoms. This is not an exhaustive list of criteria, but if you want to look at each criteria in more detail, I encourage you to look at the DSM-5. There are also certain severities and specifiers when it comes to diagnosing substance use disorder. Substance use disorders occur in a broad range of severity, ranging from mild to severe, with severity based on the number of symptom criteria endorsed. As a general estimate of severity, a mild substance use disorder is suggested by the presence of 2 to 3 symptoms. A moderate substance use disorder is suggested by the presence of 4 to 5 symptoms, and a severe substance use disorder is suggested by the presence of 6 or more symptoms. Changing severity across time is reflected by reductions or increases in the frequency and/or dose of substance use. This can be assessed by the individual's own report of knowledgeable others, clinicians' observations, and biological testing. Specifiers are also available for diagnosing substance use disorders. These specifiers include in early remission, in sustained remission, on maintenance therapy, and in a controlled environment. When looking at substance use disorder, it's important to discuss general substance use statistics. In 2018, an estimated 164.8 million people ages 12 years or older were past month substance users. These substances include tobacco, alcohol, or illicit drugs. Of the 164.8 million users, 139.8 million drank alcohol, 58.8 million used a tobacco product, and 31.9 million used an illicit drug. In terms of this class, it's important to look at adolescent substance use statistics. For instance, alcohol, marijuana, and tobacco are substance use most used by adolescents. By 12th grade, about 2/3 of students have tried alcohol. Furthermore, about half of 9th through 12th grade students reported ever having used marijuana. Perhaps most surprising, among 12th graders, close to 2 in 10 reported using prescription medicine without a prescription. Let's look at some more substance use statistics by gender. Men are more likely than women to use almost all types of illicit drugs. Illicit drugs are more likely to result in emergency department visits or overdose and overdose deaths. However, women are just as likely as men to develop a substance use disorder. Here are some substance use rates by race and ethnicity. In 2017, American Indians and Alaska Natives aged 12 and older had the highest rate of substance use and dependence at 12.8%. Whites had a substance use rate of 7.7%. African Americans had a substance use rate of 6.8%. Hispanics and Latinos had a rate of 6.6%. Native Hawaiians or Pacific Islanders had a rate of 4.6%, and Asian Americans had a rate of 3.8%. While it's evident that substance use disorder affects all races and ethnicities, it's important to note that some are disproportionately affected more than others. When looking at the etiology or cause of substance use, the simplest way is to break it down into environment, genetics, and behavior. Environmental factors include laws and norms favorable to drug use, the availability of drugs, extreme economic deprivation, and neighborhood disorganization. Let's take a look at poverty. Poverty, for example, can increase stress. Stress is a common risk factor for substance use and relapsing. The stress of worrying about how to afford shelter, food, and other basic needs can be overwhelming. When stressed, people are tempted to turn to drugs or alcohol as temporary stress relief. Furthermore, lower socioeconomic status is associated with heavier substance use. Next, let's look at genetics. Some types of substances appear to have a genetic component by increasing the individual's vulnerability and susceptibility to the effects of drugs. However, it's important to look at all factors that may influence substance use, as genetic influences are shaped and modified by personal attributes and environmental conditions over time. Lastly, let's look at how behavior can cause substance use. Behavioral influences include educational variables, such as poor school attachment or poor performance, both of which are associated with greater substance use. Additionally, studies suggest that peer influences, such as modeling use, providing drugs, and encouraging use, are the most consistent and strongest predictors of adolescent substance use. This is specifically important because the risk for initiating alcohol and other drug use increases during mid to late adolescence. In addition to educational variables and peer influences, another factor associated with initial involvement with alcohol and drugs includes social structural variables, such as family systems. Studies show that greater substance use in families with adult drug users and greater substance use in families with dysfunctional family structures can increase substance use in children and adolescents. There are developmental challenges in children and adolescents with substance use disorder. These challenges can be separated into three categories: neurocognitions, brain structure, and brain function. In terms of neurocognitions, studies have found that adolescent heavy drinkers exhibit decreases in memory, attention and speed information processing, and executive functioning. In one study comparing alcohol-dependent and healthy control adolescents, researchers found that drinkers recalled 10% less verbal and nonverbal information compared to the controls. In terms of brain structure, there are changes in the hippocampus, which affect memory, as well as the prefrontal cortex volume, which affects planning, inhibition, emotion regulation, and integration of new stimuli. In one study comparing prefrontal cortex volumes of adolescent heavy drinkers to non-drinkers, prefrontal cortex volumes were smaller in heavy drinkers relative to the controls. And lastly, in terms of brain function, substance use can impact working memory, inhibition, and cue reactivity. In addition, there are developmental effects on children and adolescents who have a caregiver with substance use disorder. An estimated 12% of children in this country live with a parent who is dependent on or uses alcohol or other drugs. Children are at risk of increased maltreatment when living with a parent or caregiver who has substance use disorder. Furthermore, child maltreatment cases in the United States are associated with substance use to some degree, with about 2/3 of cases involving a caregiver with substance use disorder. In addition to maltreatment, parental substance use can affect the well-being of children and adolescents in many other ways. For instance, an infant who receives inconsistent care and nurturing from a parent with substance use disorder may suffer from attachment difficulties that can then interfere with the growing child's emotional development. Furthermore, children of parents with substance use disorders are more likely to experience trauma and its effects. These can include difficulties with concentration and learning, controlling physical and emotional responses to stress, and forming trusting relationships. These factors can impact the child's school functioning. Lastly, adolescent children of parents with substance use disorders, particularly those who have experienced child maltreatment in foster care, may turn to substance themselves as a coping mechanism. In terms of assessment and diagnosis, social workers should possess skills in systematic assessment, data gathering, and interpretation on multiple levels. They should also use a variety of methods to assess the needs, characteristics, and interactions of clients with substance use disorders. For example, assessment tools can include interviews, direct observations, standardized instruments, and surveys. A thorough substance use assessment includes a detailed inventory of the type, amount, frequency, and consequences of the patient's substance use, their perception of their use and readiness to change, an assessment of co-occurring psychiatric disorders, a medical history, physical examination and laboratory tests, the presence of substance use disorder in the patient's family, and a review of social factors that may contribute to substance use or facilitate or create barriers to treatment. Assessment tools for substance use disorder include screening tools, as well as instruments that determine frequency, severity, and dependence. Screenings for substance use disorders tend to fall into two categories: brief screenings of 6 or fewer items that can be asked orally in the context of an interview, or longer written questionnaires that are completed by the client. Some screening tools include the Alcohol Use Disorders Identification Test, or the audit, the CAGE, or the Drug Abuse Screening Test, also known as the DAST. Screenings are used to determine the presence or absence of substance use. It's important to note that they are not diagnostic of clinical problems. Rather, they're used to indicate whether or not further assessment and diagnostic testing is required. When screening shows the presence of a substance use problem, it's important for clinicians to then assess and refer to the DSM-5 for diagnosis. There are many different treatment interventions for substance use disorder. According to the National Institute on Drug Abuse, behavioral therapies help engage people in drug abuse treatment, provides incentives to sustain sobriety, and modifies attitudes and behaviors related to drug use. Cognitive behavioral therapy is known to be one of the most effective evidence-based interventions for substance use. Cognitive behavioral therapy, or CBT for short, is based on the theory that learning process plays a vital role in the development of maladaptive behaviors. CBT helps the client develop healthy coping skills to prevent unhelpful behavior and enhance the client's self-control by analyzing positive and negative consequences of continued drug use. In terms of children and adolescents, CBT has consistently shown greater sustained or emerging post-treatment effect size compared to family-based interventions. There's also some evidence that individual cognitive behavioral therapy targeting substance use may contribute to reductions in psychiatric symptoms that include depression, ADHD, and conduct disorder. Other treatment interventions for children and adolescents include multidimensional therapy, or MDFT, which is another treatment intervention. This intervention views adolescent drug use in terms of a network of influences, such as individual, family, peer, and community, and suggests that reducing unwanted behavior and increasing desirable behavior occur in multiple ways in different settings. Treatment includes individual and family sessions held in the clinic, in the home, or with family members at the family court, school, or other community locations. Lastly, medication-assisted treatment is the use of medication in combination with behavioral therapies to provide a whole patient approach for the treatment of substance use disorders. Research shows that for youth, a combination of medication and therapy can successfully treat substance use disorders. As a group, we developed some research questions that may be important when engaging with individuals and families dealing with substance use disorder. Our first research question is, how do a drug user's actions affect themselves, their families, and their communities? Our second research question is, how can family and friends make a difference in the life of someone needing substance use treatment? Also, how can criminal justice reform better serve individuals who suffer from substance use disorder? And lastly, how can we decrease the stigma associated with substance use disorder that so often deters people from receiving treatment? We hope you enjoyed our presentation. From my group, I want to extend gratitude to Caitlin in supporting us throughout a difficult semester. We really appreciate it. Thank you.